Let's look at the ventricular fibrillation, the dangerous form of arrhythmia. Here is a sample of ventricular fibrillation. Of course, originating from ventricle. It's the multiple wavelets of re-entry. It's typically characterized by irregular with no discrete QRS. So this is a ventricular fibrillation. Easy, but very important to recognize this. So ventricular fibrillation originates from multiple foci. The ventricle is just fibrillating with no organized QRS complex. Actually, the patient is in cardiac arrest. So two more examples of ventricular fibrillation. It can take various forms, but you can see in either forms there's no organized QRS complex. Sometimes when we see patients, ECGs in asystole, it's very important to change another lead just to rule out whether it's a fine ventricular fibrillation or it's asystole, because the treatment for ventricular fibrillation is obviously different from asystole. So in ventricular fibrillation, the rate is very fast. It's usually more than 200 to 300 beats per minute or even faster. It's completely disorganized rhythm without discrete QRS complexes. It results in instant hemodynamic collapse. The patient presents sudden cardiac death. There's no cardiac output. The ventricles are just quivering, and the patient is actually dead and require immediate defibrillation. So when patients have ventricular fibrillation, immediate cardiopulmonary resuscitation is very important. External cardiac massage and artificial ventilation, and of course, external defibrillation is an important options to treat the patients. The automatic external defibrillator is very useful in for patients with ventricular fibrillation, and nowadays in many countries it's quite widely used. Here in Tokyo Metro Station, there's an AED, so that when patient has a ventricular fibrillation arrest, this can be of use.